And we have a bipartisan approach here in Canberra, including doctors joining up to encourage Australians to get vaccinated. One of them is Nationals MP Dr David Gillespie. Thanks for your time today.
My pleasure to be with you, Tom.
It's interesting. So delving into this campaign to have people get vaccinated, there are obviously people, for some reason, believing stuff that's completely unscientific, totally unfounded things that put them in the anti-vaxxers basket. But there are others that might have had cancer treatment recently that know there are a very small number out of any vaccine that don't react well to it, that have what you might call more legitimate concerns. How do you approach them?
Well, we got together, all the doctors in the House, literally, who have been medical doctors for decades, thought it was timely for us to put a statement out supporting the rollout of the COVID vaccines. They have all been through enormous amounts of analysis, both live amongst many multi-millions of people in Europe and America, and the Pfizer and the AstraZeneca vaccine are in the first rollout. We've got supply contracts with Novavax. We have got a planned stage rollout. But what I wanted to reassure people, my role as an MP, using my former medical practicing specialist knowledge, has helped inform us. And the TGA is a world-renowned regulator. And we have a vaccine implementation group in other layers in the health bureaucracy. And it's all been assessed, passed as safe and effective to benefit people, and that's the take-home message. It is voluntary, but we are strongly encouraging everyone to protect themselves and protect their loved ones, protect the elderly. It's better if the more people get vaccinated so that we do get that mass population.
Yeah, the more, it's not just your risk, it's whether you can get it and still pass it on. So as to other people with any concerns, I mean, for example, I believe AstraZeneca at the moment has not been approved for women who are pregnant. I think it is going ahead that way in Israel, but the point being, any individual with a concern can talk to their doctor and say, look, am I in any sort of risk group? What do you think of me getting the vaccine?
Yeah, well, that's exactly right, Tom. Anyone getting the vaccine would be screened by their medical practitioner, or at the first rollout, it's in major medical centres, so there'll be obviously screening and appropriateness, and they'll follow the guidelines.
Now, you're talking about the guidelines and the TGA. Obviously, it's impossible to ignore Craig Kelly. I mean, you've spoken to him before, I understand, around the official advice, why the TGA is a good authority to follow. What does he say in response?
Look, he will take the advice of his doctor, and that's pretty much the advice that anyone would be wise to take. And I expect his advice from his doctor will be that he's of an age group that is susceptible to getting a really bad virus. It is worse than the flu, and it is because none of us are immune to it. If it gets away in the community, initially it might be low-key under the radar, but eventually the numbers dictate that it ends up, you have an awful lot of sick people who overwhelm health systems, and that's what's happened overseas, and that's what we don't want to have here. We have been well managed, we've been ahead of the curve here, we want to stay ahead of the curve, get, the Australian public vaccinated as much as possible.
So you think you'll get a vaccination?
Will I?
No, you think Craig Kelly will. I'm assuming you will.
Oh, I definitely.
Right.
I'm getting vaccinated.
But you think Craig
As
Kelly
I said, vaccination offers the benefit of prevention is better than cure. It will modify the severity of illness, and it will, as Katie Allen said, it'll make a really serious disease a nuisance disease because there won't be as many cases. And the more people you get vaccinated, the less people it can jump to. And so it runs out of people to transmit itself. The thing with viruses, they can't exist by themselves. They need another cell to jump into or another human being, and that's why vaccination works so well and has for hundreds of years.
That's why it's so important. You get the concern though, right? I mean, you're out here putting this message across, and I'm sure a lot of Australians would be thankful that doctors in Parliament House have united and said, here's our message. But with this issue, it's the biggest issue in Australia right now. The vaccine is our biggest defence against it. And you've got one MP at least talking about, hey, what about these alternatives? I'm not sure about the vaccine. It's just so damaging.
Well, look...
Is it frustrating?
Look, as I said, it can confuse the message. There is a body of evidence about drug treatment, but it's not sufficient for us to be recommending other than the best thing. Like I said, prevention is a lot better than cure.
Right. And Craig Kelly talks a lot about cures. We're talking about the vaccine. You never get the illness in the first place.
Exactly. Prevention is better than cure. And the thing is, evidence emerges as more evidence is accumulated, and the level of evidence may be that down the track they do recommend other things. But the take-home message is the best thing for the public health of Australia, and I'm using my own professional background for 33 years in specialty medicine, is to get the vaccine unless your doctor tells you because of some immunological problem that you have that you're not suitable to have it. Otherwise, go right ahead and protect yourself and your family and your friends.
And just on the eligibility, I mean, there are some huge cohorts. Everyone's looked it up. I'm in 2B. There's a few million Australians there as well. Is it your understanding it's first in, best dressed? So at that stage, you might be made aware of something, or you can read it in the media, but then you've got to organise it, and it is up to you to sort of try to get in early?
Well, it's not going to be like you've seen in other countries because we're well organised and ahead of the curve. We've got many thousands of general practices in the latter stages for fit young people. There's pharmacy access in the later stages. First of all, these 16 big hubs and the hospitals around them and the centres. We have an army of people lined up to help deliver it, and we have a well-organised health system that hasn't been overwhelmed. That's the beauty of us. We have managed it well enough that our systems have coped. And so I expect we'll see a structured roll-up. Obviously, there'll be individual hiccups. Someone might spill a vial or something like that. But the systems that we have in place in Australia are very robust and well prepared. And our take-home message, help yourself, help your family, protect the broader community and take the vaccine.
Everyone barracking for that just about in the country. Just finally on the issue of Brittany Higgins and questions that have been asked since. And obviously, I'm not going to name the alleged perpetrator, and for legal reasons, we won't name them on the program, but they do seem to be relatively well known in the building. A third woman coming forward today. We're led to believe he actually worked for Nationals during his career as well. Are you aware of the individual?
Look, allegations are made about an individual, and I employ a lot of staff, but look, I prefer not to make anything about supposed allegations. Suffice it to say, no one supports violence against women, sexual harassment, violence, let alone the allegations that Brittany, they should never be tolerated. And there's a system in place to get to the bottom of it. The police are going to be involved. She said she's going back to the police on Wednesday, and we all want to get it fixed up. The National Party has a sexual harassment policy. We as parliamentarians are governed by law and by policy and procedures, and we've got this review underway. So I think everything that can be done for now is being rolled out.
Right.
It's a really important issue to get it absolutely clear and have rock-solid procedures in place so that if anything like this ever does happen again, there's a well-trodden and defined path for people to seek help.
And without straying into identification areas, it's a very broad question though. As I said, I've been led to believe that this individual worked for the Nationals as well. Is that your understanding?
Yeah, he's worked in many offices, but suffice to say, I think we're talking too much about a specific individual that allegations have been made, and he's worked across the political spectrum,
David Gillespie, thanks for your time today.
Thank you very much, Tom.